Israelis may soon be able to put away their vaccine passes for good. Israel was one of the first countries to introduce the pass, but officials now worry it could give false assurances. The Omicron variant is infecting many who are fully vaccinated. Starting Sunday, the pass will only be required in high-risk areas like hospitals, where healthcare workers are battling record COVID-19 infections.
Since the early morning, Yael Liron has been on duty on a COVID ward. An elderly patient needs oxygen and some comforting words. The COVID wards at this hospital in Tel Aviv are extremely busy.
There are a lot of cases. We have new intakes every day. When one is released, another is submitted at night. Numbers are on the rise. We always experience a delay. Even when the general infection rate seems lower, we at the hospital are still dealing with the higher numbers from the 2 weeks previously.
Though overall Omicron infection rates show signs of slowing down, the number of patients in hospital remains high. Israel was one of the first countries in the world to roll out a rapid vaccination program. Over 65% of the population have been vaccinated twice, but only 48% have had a third booster shot so far. In January, those in the most vulnerable categories were offered a fourth.
During this wave, most of our patients have been elderly. It reminds us of the flu. The complications are comparable. People are dying now the way they would die from the flu. Also, fewer people are dying of Omicron.
Most patients on this ward are vaccinated elderly people with underlying health conditions. Working on the ward is exhausting for everyone. Adding to this, hospitals, like other institutions, are struggling with staff shortages. Due to the highly contagious Omicron variant, high numbers of doctors and nurses are in quarantine.
It's difficult. It's the fifth time we've been at full capacity here in Israel, but we're dealing with it. That's just how it is, as they say, and it's our job to look after patients. But it's definitely hard, and there's a lot of burnout among the staff.
We have to work very hard, but we're happy to do what's necessary. But yes, it's exhausting, and it doesn't look like it's going to end soon. Although, I am personally cautiously optimistic.
For now, everybody here must keep going, doing the best they can for the ongoing influx of patients and hoping that the peak of the current wave will soon subside.
That report by Tanya Kramer. We can take you now to Tel Aviv and speak to Nadav Davidovich, an epidemiologist from the Ben Gurion University of the Negev. Professor, welcome to DW News. I understand that you sit on the panel that advises the Israeli government, and you've been critical in the past of some of their approaches. With cases still high in your country, is this the right decision?
The Green Pass actually was introduced in order to have safe epidemiological spaces. It was not introduced in order to enforce vaccinations. Vaccinations are extremely important. They saved in Israel, according to our estimates, about 20,000 deaths. But currently, with the Omicron and with the fact that people vaccinated, they are saved probably from hospitalizations and death, but much less so in being infected. So we need to adapt the Green Pass. We don't want to abolish it altogether. We want to keep it also for the future if needed. And currently, probably this is best to have it either as a voluntary measure or when you have high-risk situations such as hospitals, elderly care homes, or other high-risk activities. Vaccinations are very, very important. We are now in a really unprecedented situation, and we need to adapt the current measures to the epidemiology. We need to vaccinate. We need to still use the mask, of course, and I think that by the fact that we are adopting the Green Pass, it's very important also from the trust of the public.
Right. Now, Doctor, Israel has been slowly rolling back curbs. Is there widespread support for that?
I think that the current government, was trying to balance the measures in terms of keeping as much as you can the number of cases, but remembering that public health is also about social support and economy. I think that currently we could do much better in terms of opening schools. I think it was an important factor, but there was lots of confusion and tension between the Ministry of Health and Ministry of Education, and there were also criticism about the economic support because so many people are in isolation. We're learning to live with COVID. If you compare Israel's situation and other countries, to what happened about a year ago, things are very different. We have the option of testing and many other things. We need to learn to live with the virus because COVID is going to stay with us. We're learning that the FDA is going to hear Pfizer about having vaccines below the age of 5. And I think this will be another important measure because vaccination are going to enter, I think, finally into the regular schedule of children. And we are going to deal with it and strengthening the healthcare system as much as needed. They suffered a lot during the last 2 years.
Epidemiologist Nadav Davidovich in Tel Aviv. Sir, thank you so much for taking the time to answer our questions.
Thank you. Lots of health.